Also flying under the radar in international media coverage of China, an issue that's certainly important to just about everyone in China, medical care. Issues with the medical system have been addressed during the NPC session. Here's one NPC deputy.
My friend's child caught a cold and he brought him to the hospital. The whole process took 3 hours, while the doctor only spoke for about 20 seconds. How should we solve this kind of problem?
Long wait times are just one of the issues frustrating patients as well. I spoke with Dr. Shenglan Tang of the Duke Global Health Institute.
Healthcare is one of the big issues concerned by Chinese peoples. A couple of years ago, Chinese people complained very expensive healthcare, very difficult to see doctors. So that's why the highest level of politicians in China started to pay special attention to healthcare.
Okay, I just want you to take a listen to something from a doctor at the China Association for Science and Technology. He's talking about areas where medical reforms are needed.
There are 3 core issues in medical reform: the high cost of medical services, the tense relationship between doctors and patients, and the cold attitude of some medical staff. So far, these problems haven't been resolved and some have even gotten worse.
So there you have it all encapsulated by the doctor there. Do you agree with that assessment, and what needs to be done to fix these problems?
I first want to say Chinese government has made a huge progress in reforming healthcare system over the last decades. In terms of health insurance population coverage, in terms of improved access to health services and medicines. Having said that, I totally agree with you or with that doctors that there are still huge problems in terms of access to and financing of healthcare. The proportion of out-of-pocket payment by individual patient has reduced from 60% in total health expenditure 15 years ago to 40% today. That's a good achievement. Such a reduction is due to an increased investment in health services by the government.
Okay, here's another problem that we came upon. People often complain in China about the long wait to see a doctor. CCTV, we partnered with another company to uncover what issues are top on people's minds. And here's what we found. We found that people are concerned that doctors over-prescribe expensive medicine and order unnecessary tests. And then there's this. From 2006 to 2013, the number of doctors increased by under 5%, while the number of people seeking medical care grew by more than 13%. And finally, we found that medical costs are rising by about 17% a year, while per capita incomes are rising only 12%. So the question is, how can a country like China encourage more doctors to enter the workforce, while at the same time trying to keep down costs?
China has trained an adequate number of doctor nurses, but unfortunately, not all these new medical graduates come to the medical practice. Part of the reason is that many of them are not willing to work in the countryside. So in order to address these problems, I think the government should develop adequate financing and non-financing incentives for doctors and nurses to work in the rural areas.
Okay, so we're going to have to leave it there. Thanks for joining us.
Thank you.